Welcome to Top 10 World Knowledge. Smoking cigarettes is a major public health concern globally, responsible for a multitude of severe health issues and contributing to millions of deaths each year. The detrimental effects of smoking are well documented, yet the habit persists. Understanding the worst consequences of smoking can help reinforce the importance of quitting and prevent others from starting. Here are the top 10 worst consequences of smoking cigarettes, explained in detail. Today we will talk about top 10 worst consequences of smoking cigarettes. So before we start, make sure to hit the like button and subscribe to my channel. 1. Lung cancer. Lung cancer is the leading cause of cancer-related deaths worldwide, and smoking is its primary cause. The harmful chemicals in cigarettes damage the cells lining the lungs, leading to the development of cancerous cells. There are two main types of lung cancer: small cell lung cancer, SCLC, and non-small cell lung cancer, NSCLC. Both types are heavily linked to smoking. SCLC is particularly aggressive and spreads quickly, while NSCLC is more common and slower growing but still deadly. Early symptoms of lung cancer include a persistent cough, chest pain, shortness of breath, and coughing up blood. Unfortunately, symptoms often appear in advanced stages, making early detection difficult. Regular screenings for high-risk individuals are crucial. 2. Cardiovascular diseases. Smoking significantly increases the risk of heart disease, including coronary artery disease, heart attack, and stroke. The chemicals in cigarette smoke damage the lining of the arteries, leading to atherosclerosis, hardening and narrowing of the arteries. Smoking doubles the risk of ischemic stroke, caused by blocked blood flow to the brain, and hemorrhagic stroke, caused by bleeding in the brain. This is due to the increased blood pressure and reduced oxygen supply caused by smoking. Smoking can cause PAD, where narrowed arteries reduce blood flow to the limbs. This can lead to pain, infections, and even limb amputations. Smokers are up to 4 times more likely to develop PAD compared to non-smokers. 3. Chronic obstructive pulmonary disease. COPD is a group of lung diseases, including emphysema and chronic bronchitis, that cause breathing difficulties. Smoking is the leading cause of COPD. The smoke damages the airways and air sacs in the lungs, leading to obstructed airflow. Symptoms of COPD include chronic cough, mucus production, wheezing, and shortness of breath. The disease is progressive, meaning it worsens over time, and there is no cure. Treatment focuses on managing symptoms and slowing progression. COPD severely impacts the quality of life. Daily activities become challenging, and patients often require supplemental oxygen. The disease also increases the risk of respiratory infections and complications from other illnesses. 4. Respiratory infections. Smokers have a higher risk of respiratory infections, such as bronchitis, pneumonia, and the flu. The smoke weakens the immune system and damages the respiratory tract, making it easier for pathogens to invade and cause infections. When smokers do get respiratory infections, they tend to be more severe and harder to treat. This is due to the already compromised state of the lungs and immune system. Recovery times are longer, and complications are more common. For individuals with chronic respiratory conditions like asthma or COPD, smoking exacerbates symptoms and increases the frequency and severity of attacks. This can lead to more frequent hospitalizations and a greater reliance on medication. 5. Cancer of other organs. Smoking is a major cause of cancers of the mouth, throat, esophagus, and larynx. The carcinogenic substances in cigarette smoke directly contact these tissues, leading to mutations and cancer development. Smokers are 3 times more likely to develop bladder cancer than non-smokers. The harmful chemicals in tobacco smoke are absorbed into the bloodstream, filtered by the kidneys, and concentrated in the urine, damaging the bladder lining. Smoking is a significant risk factor for pancreatic cancer, one of the most aggressive and deadly forms of cancer. The chemicals in cigarette smoke cause inflammation and cellular damage in the pancreas, leading to cancerous changes. Smoking doubles the risk of kidney cancer. The carcinogens in cigarette smoke are filtered by the kidneys, causing cellular damage and increasing the likelihood of cancerous growths. Women who smoke are at a higher risk of developing cervical cancer. Smoking weakens the immune system, making it harder for the body to fight off human papillomavirus, HPV infections, which are a leading cause of cervical cancer. 6. Reduced immune function. Smoking impairs the immune system, making it less effective at fighting infections and diseases. The chemicals in cigarette smoke interfere with the normal functioning of immune cells, reducing their ability to respond to pathogens. A weakened immune system means smokers are more susceptible to infections, including respiratory infections, tuberculosis, and bacterial and viral diseases. Recovery from illnesses is also slower and complications more likely. Smoking can exacerbate autoimmune diseases such as rheumatoid arthritis and lupus. The inflammation caused by smoking can worsen symptoms and lead to more severe disease progression. 7. Poor oral health. Smoking is a major risk factor for gum disease, periodontitis, which can lead to tooth loss. The smoke damages the gums and bones supporting the teeth, causing inflammation and infection. Smokers are more likely to suffer from tooth decay and loss. The chemicals in cigarette smoke reduce saliva flow, which helps protect teeth from decay and increase the buildup of plaque and tartar. 8. Reproductive and sexual health issues. Smoking affects fertility in both men and women. In men, it reduces sperm count and motility and increases the risk of erectile dysfunction. In women, it can lead to irregular menstrual cycles, early menopause, and complications in pregnancy. Smoking during pregnancy is highly dangerous. It increases the risk of miscarriage, stillbirth, premature birth, low birth weight, and sudden infant death syndrome, SIDS. The harmful chemicals in cigarette smoke can affect the development of the fetus. Babies born to mothers who smoke are at a higher risk of birth defects, such as cleft lip and palate. Smoking affects the development of the baby's organs and tissues, leading to congenital abnormalities. 9. Aging and skin damage. Smoking accelerates the aging process, leading to premature wrinkles and fine lines. The smoke reduces blood flow to the skin, depriving it of oxygen and essential nutrients, resulting in dull, dry, and sagging skin. Smokers are more prone to skin conditions such as psoriasis and skin cancer. The harmful chemicals in cigarette smoke cause inflammation and damage to skin cells, increasing the risk of these conditions. 10. Mental health issues. Smokers are more likely to experience depression and anxiety compared to non-smokers. Nicotine addiction affects brain chemistry, leading to mood swings, irritability, and increased stress levels. If you like this video and would like to see more like it, please give it the thumbs up, leave a comment, and click the button to subscribe.